gets denied. And typically what happens is pretty much every office or hospital, they actually run a prior approvals or prior authorization to see if the insurance will cover it before they go ahead and schedule the surgery. Unless it's like an emergency situation, then that's not always done ahead of time. But it's important to get to the root cause of the issue first, and then that will help drive the solution. So some examples of why it may be denied are, it could be another coding issue. It could also be that the insurance doesn't cover that specific surgery, but they may cover a similar one. Or perhaps it's that the insurance is not credentialed or not in network, or excuse me, the surgeon is not credentialed or not in network with the insurance company. Sometimes the insurance needs to do some additional research, or they want some additional information from the provider. So in this case, being the surgeon. And lastly, sometimes there is a tiered approach required, meaning perhaps the surgery requires like physical therapy or like a least invasive approach to be tried first for the treatment. And then if that's documenting that it's failed, then surgical approach would be something that would be approved moving forward. So we actually published a blog this week on Greater National Advocate that talks a bit more about this topic in detail, and we encourage you to check it out. Christine, did you add the link to the chat? If not, I think, can you add it now for anyone that wants to continue reading it?
Oh no, that's a lot. That was a mouthful. I will add. I think as we know, and as the different explanation that Elena's been providing on just how to deal and navigate around insurance issues and getting pre-authorizations or approvals can be quite challenging. And I know that some people, like myself, before I was involved in, Pathway, I always thought that when I got a notification or a response from an insurance company, that it was the tell-all. And now I'm starting to realize, after being working in this type of field, that it's actually the opposite. A lot of times when you get the responses, especially when they're negative, usually there's a way around getting a different, submitting it a different way, the claim, or and hopefully that's what we do here at Pathway, is to help you navigate through those challenges, so you can get the right care and get the right surgeries to improve your well-being or a loved one's well-being.
Exactly. We have a little bit more time. You guys had great questions. We went through them pretty quickly. So any other questions or any follow-ups that anyone wants to talk about, or even with patient advocacy in general? We're here, so please ask away. And I see Barry is joining us.
Hello, Barry.
Christine.
There's also, as we're just waiting, I have to see if there's any other questions. We will have other webinars that'll be upcoming. Please, you can look for those in our Facebook page. If you have any questions or would like further information on any existing cases or just general information, we can be reached at, our phone number is 947-517-3895. Also feel free to email us at advocate@pathwaypa.com.
And so it's just 947-517-8395. Sorry, you just flipped the numbers.
Oh, did I? A little dyslexic.
That's okay. But it's also in the chat too. So if you didn't get that, thank you, Christine, for posting that. Vito, let's see. Did your audio get adjusted? I know you were having some audio issues. Can you hear us okay now? Thank you, Antonio, for your comment. Okay, so Max, you had asked what's a coding error. Did that help explain? Sorry, there's a little bit of a lag, so I wanted to make sure that our answer addressed your question. Do you have a better understanding of what a coding error is now?
I know that, as Elena is looking through the chat and Christine, that coding error, the way when you go to see a physician and they, whatever visit that you're there for, whatever your symptoms are, the office will attach a code next to whatever treatment they gave you, and that will determine that code when it's sent to the insurance company will determine the type of service that you received and whether the insurance company is going to cover it or not. So just a small change of a number can make a treatment being covered or uncovered. Ellen, I don't know if I explained
Definitely.
that well.
Yeah, no, that's
I don't know
great.
if you wanted to add to that.
I think that's perfect. You explained it perfectly well. And it's very, interesting because, like we said, there's so many codes and the numbers are so, for one procedure, there could be like 5 or 6 different codes. And some of them, they mean the description is very similar. So it's very easy to kind of select one code and then the insurance only covers the other code or something like that. So there is a lot of issues back and forth with coding that often are the root cause of why things get denied. Where do I find it? Where do you find the code? Okay, so you would have to look, so it depends. Typically, if you look at your bill, you'll see a code on there, and then sometimes you will also have to go back to the notes, like the progress notes, and see how it was documented and so forth. But the bills typically will have it, and that's how you would correlate it with what was sent to the insurance. So if you don't have experience in understanding this, it gets very overwhelming. We, of course, do this all the time. With our background, especially our medical and financial background, we're very efficient at finding these, and because we do it all the time as well. So it's easier for us to, to go through this quickly.
Yeah, Elena, one of the things I wanted to mention too is I believe I've seen situations even in my own, medical bills that I receive that a lot of doctors' offices don't include it. You would have to request it. So, in a lot of cases, you don't even know the code is not transparent to the patient, and they just think that their services have been denied. So there are some situations where you would have to call the office and ask or your insurance company and ask specifically why it was denied, and that's where you get into the coding conversation.
Definitely. And then the other thing is let's say we didn't really address this yet, but let's say you don't have insurance, or for some reason your insurance in fact does not cover the treatment that you need. Interestingly enough, which many people might not know this, is every hospital or every provider actually has pretty drastic differences in fees that they provide. So, one hospital may charge, let's say, $30,000 for a procedure, and a different hospital might charge $120,000 for the exact same procedure. Prior till recently, as a patient, you didn't really know what the charges were. So now, in recent years, there has been a push to have patients be aware of and knowledgeable of the charges. So now hospitals do have to actually display some or have available to patients what their charges are. And so knowing that, you can go, sometimes it's hard to find, but you can go to their website and really see, okay, this hospital charges, let's say $200,000 for a specific surgery, where the other hospital, is a fraction of the cost. So if I don't have health insurance and I really need this procedure done, maybe I'm going to look to see which provider I want at the other hospital, because maybe you can afford it a bit more.
Yeah, absolutely. I think one of the things that is naturally happens is that individuals that don't have insurance might look at those costs a little more in detail, because it's not your insurance paying for it, it's out of pocket, or there's a way that you have to figure out how to pay for it, and there may be hidden costs that normally you wouldn't seek or notice, but when you start looking at the fine detail, and that's where from comparing one healthcare provider to another, you're going to find differences.
Definitely. And so it's called no surprise billing. That's kind of the new laws that have been passed and so forth. But it's also important to understand what that means, because one hospital can be, or a facility can be listing, let's say, a procedure as X amount of dollars, but it doesn't, you really have to look into the details of it. What is that covering? Because the other hospital might be breaking it down different.
Right.
So there might be a few different codes associated with it. So you really have to be careful to understand what's the total cost, because if we take a surgery, you have the cost of the surgeon, the cost of the facility, the cost of the anesthesiologist, the cost of the nursing staff, and all of that. So it all adds up, of course, and then depending on how many stays you're anticipated and things like that. Yeah. So it kind of can get spiral into a bigger picture.
Yeah.
And Max, you had asked, do you do second opinions? Yes, we do second opinions. That's something we
a really good question, actually.
Frequently do. Yeah, that's a great question.
And I would always, I'm sorry to cut you off.
Yeah, no, go ahead.
But I would actually always recommend that.
Definitely.
Anytime you're giving a diagnosis and need some type of procedure or surgery, to always get more than one opinion. It's almost like, shopping for a very expensive product that you want to make sure that you're getting the best price. And that's something that you're talking about someone's health,
right?
That you should always seek more than one opinion. So that's actually a great question.
Yes, definitely, especially if you have a rare disorder or symptoms that are not really diagnosed, and then you get a diagnosis and you don't really think it's accurate, or maybe the treatment seems off. Or let's say you got diagnosed with cancer. Cancer is a big one. And it's super time sensitive, right? So some people think, well, I don't know if I have time to get a second opinion. You do. And we can help. We can help you find a very appropriate second opinion in that specific field that you need in a time sensitive manner. And so I don't ever see a negative of getting another opinion. The worst that can happen is you get the same answers, which is actually helpful, because then you
confirms.
Exactly.
Yeah.
Exactly. And I think the other side of it, because, years and years ago, it used to be like, okay, if my doctor or my provider tells me something, I'm just going to go with it and believe them, right?
Yeah.
And you really do want to have a trusting relationship with your provider 100%. But those days have changed where it's not offensive, or it shouldn't be offensive, to get a second opinion to the provider. And a lot of people are worried about that. Like, oh, well, if I get a second opinion, what if my provider gets offended and then they're not going to treat me as well? Yeah. And in reality, if you have a good provider, then they should not care. They should encourage you to go elsewhere, because they would want you to feel comfortable with the treatment that they decide, or go with whatever treatment that you feel better. So if you do encounter that, and I don't think you'd encounter it often, but if you do, then maybe that provider is not the right one for you.
Yeah. And then one of the things that kind of brings to mind to highlight is, I know we had, I think it was Vito that, mentioned clinical trial. Mm-hmm. It's especially more important when you get that diagnosis, or someone that gets a diagnosis that says there's nothing that can be done.
Correct.
Because he mentioned clinical trials, and there's so many different types of clinical trials that are out there. And that's, I think, one of the things that, we've helped patients
yes.
Find and have cured, or given them prolonged mm-hmm. the timing of whatever diagnosis that they originally given. So that's something everyone should always seek.
Our goal is to really help do the research and make the connection so that you can get into those trials that you want, or get into that provider's appointment to determine if that's the best trial for you. And the other thing is even if you have been told there's no clinical trials, that may be true, but there's still other options to at least explore. So we can help you exhaust all the options, so at least that you feel comfortable knowing that you've looked at everything, think everything's been considered. And so there are instances where, maybe there isn't a current recruiting clinical trial, but there may have been a drug that just or some kind of treatment that just recently ended clinical trial, which is kind of, sometimes even better, because the results, and you can get, and maybe that drug isn't yet FDA approved, but we can still help get that treatment to you by just kind of working through and networking into who we need to reach to see how we can kind of get you in front of the person that's able to help get you that treatment. So there are ways that we can work around it.
Well, we've spiraled into a lot of different conversations.
Yes. Yeah. Any other questions before we kind of wrap up? Great questions, though. We like when people ask questions because it gives us more of a conversation.
Food for thought.
Yes. All right. I think
Is that
I
it?
don't see any more. Oh, yeah. Thank you, Christine, for pointing out. We also do have this on YouTube and Instagram as well. So you're welcome to follow us on any of those. And if you have questions, you can always give us a call. Like Angela mentioned, you can text us or, excuse me, message us on our social media. And let's see.
We're still
Sorry.
getting
I think this is lagging. I'm
messages.
trying to multitask here. Are you only located online? So everything that we do is remotely, but we do service all 50 states, as well as Canada. So we can definitely help in any state. We also virtually will attend appointments for you, or with you, excuse me, and we can really be as available as you want us to be. And the advantage of us working remotely is that we are more readily available, and then we don't have to worry about travel time and so forth. Yep. So thank you. Good question. All right. Well, everyone, enjoy your Sunday.
Yeah. Thank you for
And,
joining,
yeah.
everyone. Please look for our webinars that are scheduled in the near future.
Yep.
I don't know the next date.
I think it's
offhand.
February
Next month.
8th, I believe, but it is listed, so I
Yeah.
believe it's February 8th. Christine, if you have it, can you just add that to the chat?
And yeah, please have your neighbors join, friends, whoever you may think that can benefit from hearing any of these topics.
Yeah, spread the word. We'd love to help as many people as we need to.
All right. Thanks
so much.
everyone.
Bye.
Bye-bye.